Coronavirus Live updates. House passes $484 billion aid package. A $484 billion coronavirus aid package is headed to President Trump's desk after the House cleared it 388-5 on a bipartisan vote. The House on Thursday gave resounding approval to a $484 billion coronavirus relief package to restart a depleted loan program for distressed small businesses and provide funds for hospitals and coronavirus testing, moving to ramp up oversight of the sprawling federal response to the pandemic. President Trump said he was grateful for the action and would quickly sign the measure as early as Thursday evening. It was the latest installment in a government aid program that is approaching $3 trillion, which passed with broad bipartisan support even as some Democrats condemned it for being too stingy. But the fight over what should be included foreshadowed a pitched partisan battle to come over the next round of federal relief, which is likely to center on aid to states and cities facing dire financial straits. Even as they dispensed with another nearly $500 billion taxpayer dollars, Democrats were moving to scrutinize the administration's handling of the funds. Just before the aid package passed, they pushed through a measure creating a special committee to investigate the Trump administration's response to the pandemic and the array of federal spending measures enacted to address it, defying objections from Mr. Trump and Republicans. The committee, which will have the power to subpoena documents and witnesses, is charged with examining the implementation of the coronavirus relief packages enacted over the last 2 months, and scrutinizing preparedness for and response to the coronavirus crisis. The package passed on Thursday was an interim step after enactment of the $2.2 trillion stimulus law. It emerged after a flurry of negotiations between Democrats and the Trump administration after funding lapsed for the Paycheck Protection Program, a small business loan program created by the stimulus plan that had been overwhelmed by demand as soon as it began. The measure replenished that program, providing $320 billion for it, but at the insistence of Democrats who demanded additional funds and policy changes. It also included $75 billion for hospitals and $25 billion for testing, plus a mandate that the Trump administration come up with a strategy for helping states deploy and access tests across the country. The vote took place in a House chamber transformed by the pandemic. It was an impassioned debate as lawmakers, most of whom covered their faces with blue surgical masks or homemade swaths of fabric in an array of colors, patterns and glitter, reflected on the effect of the pandemic on their individual districts. Speaker Nancy Pelosi at one point donned purple latex gloves to cast a vote. Multiple lawmakers who had previously had to isolate outside of Washington after testing positive or being exposed to COVID-19 returned to vote. Representative Maxine Waters, Democrat of California, her voice cracking with emotion, said that she dedicated the bill to her sister, who was dying of the disease in a St. Louis hospital. Representative Alexandria Ocasio-Cortez of New York, who has said the measure was far too small and should include aid to struggling states and cities, was the sole Democrat who opposed the bill. 4 Republicans voted no, while Representative Justin Amash, the chamber's lone independent, voted present. After Trump's rebuke, Georgia's governor signals he will stick with reopening plans. Georgia's Republican governor on Thursday appeared undeterred by a torrent of resistance, led by Mr. Trump, to his plan to allow many businesses to reopen this week. Less than 24 hours after Mr. Trump said he opposed Governor Brian Kemp's strategy, saying that he thought he was acting too soon, Mr. Kemp used his Twitter account to publicize a list of frequently asked questions about how Georgia intended to relax its rules. He gave no indication that he intended to reverse his decision, announced on Monday, for what he described as a measured process meant to bolster the economy. The governor's plan gives permission to gyms, hair and nail salons, bowling alleys and tattoo parlors to reopen on Friday. Then, on Monday, restaurants are allowed to resume dine-in service, and movie theaters and other entertainment venues can reopen. Mr. Trump rebuked Mr. Kemp even more strongly on Thursday evening. "I wasn't happy with Brian Kemp," Mr. Trump said at the White House briefing, adding that while he had told Mr. Kemp to do what he thought was necessary, he believed that the governor's plan to reopen Georgia's businesses did not follow the federal guidelines that his administration detailed last week. I don't want this thing to flare up because you are deciding to do something that is not in the guidelines, Mr. Trump said. Mr. Kemp's decision was immediately assailed, as public health experts, the mayors of Georgia's largest cities and others warned that it stood to have perilous consequences. Business owners who were otherwise eager to revive their livelihoods said they would hold off. Then Mr. Trump added his voice. The death toll in Georgia stood at 872 on Thursday, having risen by more than 100 since Mr. Kemp announced his reopening plans on Monday. And the state has now confirmed 21,512 cases, the Georgia Department of Public Health reported, up from 18,947 on Monday. Mr. Trump's head-spinning criticism of Mr. Kemp's plan has sown confusion among Georgia Republicans, who saw Mr. Kemp, a full-throated Trump fan, win the governorship in 2018 on the strength of a presidential endorsement. It has also sent a confusing message to other Republican governors who are confronting politically fraught decisions over whether they should loosen their own restrictions in the coming days. On Thursday, Governor Roy Cooper of North Carolina, which borders Georgia, said he would extend his state's stay-at-home order until May 8, saying on Twitter, "We need to slow the virus before we can ease restrictions." Mr. Kemp acknowledged speaking with Mr. Trump in a series of Twitter posts after the president's briefing. And while he praised Mr. Trump for his bold leadership and insight, he gave no indication he was reconsidering his decision. "Our next measured step is driven by data and guided by state public health officials," he wrote. States around the nation have been trying to balance combating a public health crisis with the need to ameliorate a growing economic crisis. In some states, small protests, with the support of some conservative groups, have urged governors to ease restrictions. But polls have found that Americans are more fearful of easing restrictions too early than too late, and some business leaders have cautioned against moving too quickly to reopen. On Wednesday, Mayor Carolyn Goodman of Las Vegas called for the city's casinos, restaurants and other businesses to immediately reopen but declined to provide any guidance on social distancing measures that might protect employees and customers. "They better figure it out," she said in an interview on CNN, during which she said she had offered the city to be a control group for relaxing restrictions. The mayor, an independent, does not have the power to reopen the city's economy, but Governor Steve Sisolak of Nevada, a Democrat, and the largest union representing Las Vegas casino workers swiftly condemned her comments. "I will not allow the citizens of Nevada, our Nevadans, to be used as a control group," Mr. Sisolak said. As another 4.4 million file for unemployment, help is slow to arrive. Nearly a month after Washington rushed through an emergency package to aid jobless Americans, millions of laid-off workers have still not been able to apply for those benefits, let alone receive them, because of overwhelmed state unemployment systems. Across the country, states have frantically scrambled to handle a flood of applications and apply a new set of federal rules even as more and more people line up for help. On Thursday, the Labor Department reported that another 4.4 million people filed initial unemployment claims last week, bringing the 5-week total to more than 26 million. Nearly 1 in 6 American workers has lost a job in recent weeks. At all levels, it's eye-watering numbers, said Torsten Slok, chief international economist at Deutsche Bank Securities. Laid-off workers need money quickly so that they can continue to pay rent and credit card bills and buy groceries, he noted. Yet according to the Labor Department, only 10 states have started making payments under the federal Pandemic Unemployment Assistance Program, which extends coverage to freelancers, self-employed workers and part-timers. Most states have not even completed the system needed to start the process. States manage their own unemployment insurance programs and set the level of benefits and eligibility rules. Now they are responsible for administering federal emergency benefits that provide payments for an additional 13 weeks, cover previously ineligible workers and add $600 to the regular weekly check. In Florida, hundreds of thousands of unemployed people have been waiting for weeks for a check. It has taken some as long as that to file. As Florida's unemployment website became unusable under the weight of the traffic, the state agreed this month to accept paper applications, a tacit acknowledgement that the system was all but broken. Florida's breakdown became a national symbol of distress, when footage of a snaking line for those applications outside the public library in Hialeah, a blue-collar city outside Miami, drew wide attention online. The debacle has become an embarrassment for Governor Ron DeSantis, a Republican. He called the system cumbersome last week and acknowledged that only 4% of 850,000 pending claims had been paid. He appointed an unemployment czar and signed executive orders waiving some requirements to ease the traffic on the website. The number of paid claims has slowly inched up. Florida is a terrible state to be an unemployed person, said Michelle Evermore, an unemployment insurance expert at the National Employment Law Project in Washington. It's hard to get in. Once you do, it's easy to get disqualified. The benefit level is way below average. And that was before the crisis.